some of the real benefits for effective care, I think, is you have this huge history for a patient and suddenly you're responsible for them, and to be able to have that AI pull out the insights that really matter.
A lot of people are worried about the speed at which things are moving. Is that something you see in healthcare a lot?
I think if we have really good breaks, that you're able to actually accelerate further and faster. And
is the AI going to really change the process, or is it more about just speeding it up a bit?
AI means so many things to so many different people. Once you gain time efficiency, that's great. And then
when you're looking at the patient side, are the worries justified?
The unintended consequences of privacy is sometimes, the loss of life. So I think we need to put that in perspective.
Hello and welcome back to Healthcare Journeys, presented by S2M Health. My name is Kevin Rosenquist. I am your host today. This podcast is brought to you by S2M Health, a trusted partner for U.S. healthcare payers and providers. From accurate risk adjustment coding to full spectrum RCM services, S2M Health combines clinical expertise with precision operations to drive better outcomes across the healthcare ecosystem. We are looking at the future of digital health with a true industry pioneer, Professor Linda Macomber. She has spent over 3 decades building the digital backbone of modern medicine, leading major health tech rollouts for Kaiser Permanente and a $1 billion pilot for the Department of Defense. She is also the founder of the Master of Science in Health Informatics program at National University and the creator of Renaissance Health. Linda, thanks for joining us.
Oh my goodness. Thank you so much for the invitation and kind introduction.
Hey, it's a pretty impressive introduction, and I didn't have to even make any of it up. It's
all good.
You've been pioneering health informatics for over 3 decades. We kind of went over your awesome resume and whatnot. When you look at the current AI wave, what feels truly brand new and what feels like history repeating itself?
Well, I created Renaissance.Health because I like to look at how the past does really help us to progress with the future and look at it as a progression. But certainly we live in historic times, and really over in terms of the health tech, in addition to my career in healthcare, starting out as an ICU nurse, I have not seen anything like this. But certainly there were foundations of it that we can grasp onto that. So I think what is old is new again in different flavors and different perspectives. Certainly, I started working with various algorithmic and analytic, more deterministic AI back in the 1980s, working with Boston hospitals and then with the Department of Defense, University of California, Kaiser Permanente, and others. But certainly the probabilistic nature, the way that the computers have learned to speak English now, so we don't have to speak as much computerese. I think the potential is just absolutely unprecedented for being able to address really challenges that we've had forever. So to focus more on the priorities, on what we can do with AI today versus just what the AI can do. Is an incredible differentiator, because it's great to really address priorities and to advance care and health. And I think oftentimes we focused a lot on the problems. We focused on getting the data in, but now we can really use the insights out.
People are super skeptical, super scared of AI, and possibly rightfully so. And a lot of it's slow to adopt by certain people, and certainly those nerves fall into the healthcare space a lot. Do people want, whether it's privacy, do they want AI agents helping them with things, that are important to their health and whatnot? A lot of people are worried about the speed at which things are moving. Is that something you see in healthcare a lot? Are people worried about that speed? Is that one of their primary concerns?
Yeah, it's interesting. I often think of advancing care is, you have the accelerator and then you have the brakes. And, certainly there are many people that devote their career to one versus the other.
Yeah,
but ultimately, I think if we have really good brakes, that you're able to actually accelerate further and faster and more safely. So there's always been, Silicon Valley, go fast and break things. And then you meet healthcare and it's like, well, first do no harm. And those have always been, clashing. And so I think it's reasonable for those that are on the front lines that have the medical legal responsibility to be cautious, to really make sure that the systems work, particularly because of that journey from deterministic to probabilistic. I mean, it's not as though we've tested those algorithms and they work every time the same way as they used to do in the past. Now we're working with this new creative spirit that is it is absolutely brilliant at times, and then other times not so much. So I think it still requires the human wisdom to discern, when to use it, how much, and to make sure that we're verifying before you really touch the patient and make those decisions that make the huge difference. So it really comes down, in essence, to looking at the level of decision that's being made and the potential risks associated with it, and appropriate amount of caution that aligns with that.
As far as AI handling clinical charting automatically, which is an interesting use case for sure. For any healthcare executives and recorders listening, what does true liberation look like operationally, and how does it change the ROI of a clinic?
Yeah, sure. I mean, keyboard liberation, and certainly, less
I saw that. I liked that idea.
Yeah, less time with screens, and more time with eye contact, and certainly the whole ambient perspective. I think we've had ambient systems helping us out for a long time, but just not at the level that we have with some of the newer systems that have captured voice. And so I think there are certainly challenges and tremendous potential return on investment on the ROI. Really has two levels, one which is new and one which is more classic. I mean, certainly the gift of time is really, the most precious thing that we all have.
Right.
And so as we value the time, not just as us as individuals, but the time of physicians and nurses and healthcare professionals and the whole care team, that really brings back a whole level of humanity. I think on the other side, though, sometimes, people are a little hesitant. Maybe the truth is out there, but I think there are incentives of the algorithms to try to, in essence, chart more, to be able to bill more. And that's an old-fashioned perspective of, whether it's called upcoding or just the right amount of coding, because oftentimes, some of the revenue gets left on the table because it's not included in the records. So hopefully that can ensure that healthcare delivery system does have the appropriate revenue for the services rendered. I think that certainly you can cost justify some of that, just as we did back with electronic health records, even before high tech, we could justify them based on the increased revenue. But what unfortunately that incentive ended up providing really a focus on documentation. I'm hoping, and I think there's potential for us to maybe even get rid of the word documentation system and call them communication systems, and really decision support systems. I mean, we used to call them patient care information systems back before they became EHRs. And I think that there's something to that. We got so focused on the records and looking backwards from the medical and legal and financial perspectives. I think that we lost sight that we can really use this technology to better coordinate care, to better provide just the right information at the right time and to make those decisions. And the potential is unprecedented to make better decisions, much more personalized, much more informed with current practice. Really, the essence comes back to a time when what inspired my career was Dr. Don Lindbergh with the National Library of Medicine, and he had shared at one point, just when the medical libraries were coming online, that we needed to ensure that all of the medical information and the current journals and practice was all digital, and that we had all the patient information digital so that we can connect them together to make better decisions. And that was, a talk that inspired me in 86. And I think that we're just really 40 years later, making that promise become even more of a reality.
Yeah, and that's interesting that you put it that way, because when you think about it, I remember when things went digital with documentation and whatnot, and people were hesitant. People did not like it. They were nervous about it. And it's kind of the same thing now with AI. And from a patient perspective, I feel like a lot of patients are frustrated with AI, or people in general are frustrated with AI because they worry about privacy, they worry about accuracy. When you're looking at the patient side, what do you feel are the worries justified? Are you should we be more interested in the focus on the coding side and less about the doctor-patient relationship when it comes to AI? Like, how can people be comfortable?
I guess particularly as I get older, I really value the outcomes. So if I need to give up a little privacy so that I'll live longer and better and, leave a hospital sooner, require less treatments, I think that there, and simply have a success because I shared all of the information, and all the information was shared that needed to be at the right time. There's no question in my mind that information not getting to where it needs to go, not to be over exaggerating, but people die. You make incorrect decisions based on information that's not there. So I think the unintended consequences of privacy is sometimes, the loss of life. So I think we need to put that in perspective. So clearly, I think that when it comes to the balance of, care coordination, sharing of information, and what's possible now that you can be the CEO, you can be the orchestra conductor of your own healthcare, and so you now have access that we just didn't have previously. So looking at it from the perspective of I guess just balancing priorities. And I think sometimes we put privacy a little higher versus outcomes.
Yeah, and I think that's that's a good point. I mean, privacy, it's such a buzzword now too, right? It's like, it's not even just, we all care about it, don't get me wrong, and we always have, but now in this age of AI and computers and technology, I feel like the word is getting used in perhaps other ways, and or at least maybe too much of it is being there's too much pressure on it, which but I mean, our data's everywhere now, right? So like, I think to some degree, either we have to either just accept it, or we have to really stand up to it, because we can't just pick and choose where the data is going to be used. People give up their data all the time when they sign up for a new app or a social media or something like that, but yet they don't like it in other ways. And it seems like AI is that word that freaks people out in that respect. So it'll be interesting to see how long it takes for people to become more comfortable with it.
Well, I think part of it is looking back at the old-fashioned perspective of consent. And if I consent to share my information with any of the AI foundation models, that's very different than someone else sharing it without my consent. And so I think that it'll be very interesting as through various pathways, whether it be through the industry partners for the electronic health records systems, connecting with the AI foundation models. Certainly one option is from within your patient portal to be able to then access the AI using your health information. Many people are certainly downloading information from their portals and then uploading that into the various AI models, but that's their choice. I think it's important that people be literate and understand, things that some people don't know, like, do you really want to train the models? You can turn that off. There are a lot of areas where you can potentially address errors of omission. Where healthcare is so hyper specialized. Sometimes the AI does an interesting, consult on, looking at the various connections and finding things and seeing things. I mean, certainly. When it comes to identifying cancer 2 years earlier because of the imaging systems, that's a different AI system than identifying a rare condition that may have been missed in a child. So there just, I think, more opportunities for better communications, totally reinventing patient education, to have that be much more media rich, much more personalized, much more understandable, in the language and education level that we can all become, just a little smarter about our own health. What do you think?
I like that. And when we're talking about health systems, redesigning care using AI, is it more a workflow thing or is it a speed thing? Because a lot of people complain and say, well, healthcare processes are really clunky and, kind of old school and whatnot. Is the AI going to really change the process, or is it more about just speeding it up a bit?
Well, I let's hope that we're creating and redesigning the entire healthcare delivery system, because there's a huge opportunity to address bringing care to people instead of people to care, but go far beyond simply the efficiencies. I think that AI means so many things to so many different people. To some people are referring to the ambient systems, voice-enabled systems to get the information into a chart as that's what equals AI. That's just one small application, one small use. I think that the areas of opportunity for more effective care delivery requires a much bigger strategic look at things. So certainly, if once you gain time efficiency, that's great. And then, but think of the capabilities of, that decision support for physicians, nurses, for everyone, to be able to find all patients like mine and how did they do, and what treatments were provided, and have that as a knowledge base, really connecting the current information right at the point of care when you're making those decisions, and to make those collectively and more openly. So it's a partnership between yourself and your care team. I think that we can look at things much broader than just the efficiency. Although the gift of time will hopefully give us that ability to say, wait a minute, now that we've got some time back, then we can move forward. I do think, though, in summary, that sometimes it's not as much time as you think, because you do need to still review the information. And I think that there's less risk because I'm putting my license on the line as I click after that to make sure that anything has been appropriately transcribed into the system. But some of the real benefits for effective care, I think, is, it's like, oh my heavens, you have this huge history for a patient and suddenly you're responsible for them. And to be able to have that AI pull out the insights that really matter, I think we can move beyond just a problem list to a real shared priority list and a plan of care that is something that we're always looking at. What is that key priority? I think the AI can help us with that.
Yeah, I could see that. And switching gears a little bit, but kind of keeping
Sure.
the same idea. You're the founder of the MS in Health Informatics program at National University. So you're kind of shaping the leaders who are going to run tomorrow's healthcare systems. How has what you teach changed over the last few years? And maybe what is the number one non-technical skill that a digital health leader needs today?
Well, I think that clearly that leadership and all of those, the human skills to coordinate teams of people and adding AI assistance to your team. So certainly, as I teach, I want students to fully use generative AI to their fullest capabilities. I call it AI meets AI with academic integrity as a foundation. And once you have the kind of that established, then I think we can go beyond, just summarizing what we've done in the past in an academic sense, but to make proposals and plans and have the next generation of healthcare leaders come out with some solid ideas that have been vetted through their academic process, and so that they're ready to contribute, ready and prepared to move into a world with an AI capabilities that we've never had before. So I think it's important to practice using AI and to be aware of its promise and potential, avoid the perils. I think that's essential for the future healthcare leaders as not even just literacy, but I think fluency in the application of AI, both in education and in healthcare. There's a lot of crossover, actually. There's a lot of education that we do in a learning health system.
Absolutely. Now, from the coding side, how do we ensure that the coding workforce is, being upskilled rather than left behind in this sort of era of ambient intelligence?
Well, I think that there's a very important role for the coding to be audited and for us to continually assess the quality of the systems that are being used. And that takes people that understand the heart of coding, and particularly now that we have, really there's 80% or so of a lot of what's been in the medical system, has been unstructured data. And so how can we truly leverage this unstructured data and the AI systems to really help us, and not to only look at the coded data?
You Renaissance Health platform that you were you were the main person in that, correct? Like that's your place, yes. Your company.
It's my, yes. It's I'm the creator and editor.
What is the big goal of Renaissance Health? Why did you create it?
Actually, when you look at the from an education lens, and then really from the healthcare delivery lens, that oftentimes there's a gap between graduates in academia and then being ready to contribute, and often internships help bridge that gap, but it can be difficult to scale those. So oftentimes you would be, see one, do one, teach one, but the C1 often lives in many of the phenomenal videos now that are available. So it started as access to various electronic health record systems, so students could use those, and it progressed towards, let's immerse ourselves in the videos that are available in health systems across the country and around the world through different industry partners, and share emerging and best practices. I previously chaired the Davies Award for the HIMSS organization, and I'm now a Life Fellow. And so I love studying what works, and I think that that's an important progression of learning for all healthcare leaders, and certainly for graduate students. So I put together what it just grew from really a health tech discovery lab to over 60,000 people using it. And now that we have AI, when you have a really robust website of any kind, you can use the browsers and different systems. I happen to use Perplexity and Notebook LM and Claude quite a bit.
I'm a big fan of Notebook LM.
Yeah, I mean, it's amazing the synthesis, summary, and visualization. So
Yeah.
you'll see that I've created quite a few videos using Notebook and other synthesis and summary perspectives, looking at health tech and digital health from the individual as well as the health professional, the healthcare organization, public health perspectives. But there's so much information out there. There's a need to curate the interesting perspectives and add relevance to curriculum in this dynamic world that we're living in with technology. I mean, academia is not really designed for that. So Renaissance Health enables anyone who's interested to look at the AI Creativity Festival, just find examples of where you can go, what you can do, just simply to look at emerging practices and a lot of articles as well. So it's really designed for the curious soul.
Renaissance implies rebirth. I mean, is healthcare undergoing a literal rebirth in your mind?
I think that honestly, with the capabilities of AI, you look at Renaissance in Europe after the plague, and we had the pandemic, and now the regrowth of the human side of care, I think, is starting to see, the early sides of some say this it's the singularity on the AI side, but I think of it as a renaissance, because if we don't want to leave behind all that was good about all of the past systems that we've used, but we've got this whole new capability. So we don't want to throw away the old. You want to hold on to what's good and build upon it, and then, but also, just open up our eyes to what's possible. I think myself not as a pessimist or an optimist, but a possibilist. But it's sharing what's possible. Yeah, and I guess now with AI, a bit of a probabilist as well. Right?
Yeah, probably with AI. Yeah,
probably. Because of the probabilistic nature of all these systems. But I think that it gives us a little more hope and the best area for a renaissance to start, I do think, is with our health. And I think we can address those fears that you were sharing earlier. As we look at what AI for good, usually healthcare and education come up pretty quickly on the top of the list.
Agreed. Yeah, especially healthcare. I mean, like when you see some of the stats, like you brought up the detecting cancer 2 years in advance, it's a big deal. Like that's I've seen people be able to detect. They're able to detect Parkinson's because of speech patterns that AI detected and things like that. I mean, it's like that kind of stuff. When you hear that, like no one can argue the value of it. I think that there's just a general, hesitancy in a lot of people to embrace it. But you brought up a really good point just now. You said that you don't have to forget everything about the past. It's not like everything was broken beforehand. It just we have a chance now to say, okay, how can we take this and make people's lives better?
Yeah, for sure. And it's not just making them longer; it's making them
yeah, that's true.
The health span in addition to longevity. And I do think that it's not unrealistic that these systems can help. I think as we look to more from a redesign perspective, we can be far more proactive. We can absolutely, catch health issues when they're just a whisper. And, with a lot of, I like to think of it as self-monitoring versus remote monitoring. I think sometimes if we could just rebrand things, that people would be like you're being, you're fearful of surveillance. Well, it's like, wait a minute, no, I'm empowered, and I'm going to identify some of these earlier with a more connected care system.
Mm-hmm.
But again, sometimes there's a specific billable code that has a certain name on it, and then everyone goes with that. So what are your thoughts on sort of the what's next? I think that proactive care is one, more personalized, it's really protocol has equaled quality in the past. I think as we progress, that a personalized plan is far more economically feasible if we put these systems into practice.
I agree. I mean, I think the personalized care and I mean, there's a lot of talk about these systems helping patient, doctors and nurses and everybody else. I think you made this point earlier, spend more time with patients, have more actual face-to-face contact and conversations about health rather than sitting there putting notes into a computer and I mean, doctors use the AI Gemini tool now to speak their notes, and then it gives them a synopsis and a summary afterwards. And I mean, I use that all the time. I mean, I can't even imagine what that would save a doctor or a nurse, and accuracy too, right? Sometimes you might not remember something totally accurately, but the tape doesn't lie. So I don't know. I can see it's obviously not stopping, that's for sure. But I would really like to see the patient care improve, because I do think that sometimes people feel like they're rushed in, rushed out, and they don't have that opportunity that maybe, our parents had, where you got to sit down and talk to a doctor and they knew you and all that stuff. I feel like that's kind of gone away, and perhaps this can help bring it back.
Yeah, I think that's a piece of it, but I'll throw maybe a little bit of a different perspective on top of that, because it oftentimes people consider screen time to be evil. But
yeah, it's true.
But if the screen time with the appropriate AI actionable insights are communicated well, and if it takes, my doctor or nurse more screen time to get the right insights out, I would rather them spend more time on the screen. But
True.
Again, it's related to the outcomes. So if personalized health equals quality, if we focus more on really, it's not just the financial return on investment, but it's really our ability to be healthier. And that's a different metric. So yes, it's wonderful to have those longer conversations to be able to determine it's always the classic, it's not what's the matter with you, but what matters to you. That takes a longer conversation.
Right.
And so I think that a combination of the gift of time, also with potentially leveraging a redesign of the healthcare system. I mean, my dream would be that we have an awake doctor or nurse that's looking at those insight dashboards, and we can leverage time zones to do that. So even back with Kaiser Permanente, I was part of creating what was called team quality alerts, so some very early dashboards in the 90s. And now we have the ability to just scale that with a lot more information, a lot more insights, the combination of taking what we know and then what we do with what we know is a whole different world than just, let's capture, the note for the purpose of billing and documentation on the medical legal side. So I'm encouraged that there certainly are some of the, whether they call mission control centers or care traffic control. I think there are a lot of ways that we can help get rid of waiting rooms, increase access to care, really just simply improve the system by leveraging people that are awake across time zones to be viewing those dashboards, and then calling that nurse, for example, at 2 a.m. and saying, "Hey, did you really look at Mrs. Jones? Because maybe
Right.
that new grad was working on Mr. Smith at the time." And so I think that it's when we look at those types of applications, there's always difficulties with handoffs and coordination of care and shift change times, information that doesn't go where it needs to. I think we can fix those kind of classic old challenges. Really, I don't think I've ever worked in over 40 years, and I've traveled all 50 states and 5 continents, and communication has always been a challenge.
Yeah.
Because healthcare is so complex, and so hopefully we can kind of translate not just between English and Spanish, but translate into what is truly understood by an individual patient.
I like that. I think that's great. All right. Well, Professor Linda Macomber, thank you so much for your time. How can people get in touch with Renaissance?
I'm available on LinkedIn, and the link is there. And Renaissance.health is the website. But certainly LinkedIn is Linda Travis Macomber is the best way to get a hold of me.
Awesome. We'll put it in the show notes too, so anybody can reach out if they need you. Linda, thank you so much. Really appreciate your time. Enjoyed the conversation.
Great. Thanks so much.